It is the mission of Fortis College's nursing program to serve the needs of society by offering an excellent nursing program that exemplifies the highest standards and educational outcomes. The nursing program is based upon contemporary educationally sound conceptual frameworks, which include supporting concepts of critical thinking, nursing process, therapeutic interventions, therapeutic communication, and leadership to help students develop and expand their nursing roles. We have both simulation and clinical, and we also have lab for all of our different nursing classes. And I'm going to introduce now our simulation coordinator, Stacy Carter, who will walk you through the simulation lab.
Hi, I am Stacy Carter. I am the simulation coordinator for both the ADN and the PN program here at Fortis College. As you can see, the purpose of this room is we have it set up to simulate what would be a real-world hospital or long-term care facility room. It is equipped with all the implements that would be found in those situations. Our goal is to place each nursing student in a simulated med surgical or critical care scenario and have them evaluate the patient, who in this situation is our high fidelity simulator, Stan, who is able to function as a real patient who has heart sounds, lung sounds, pulses. He has the ability to bleed, and they assess him throughout that simulation, and that places them in a safe learning environment so they are able to practice both their critical thinking skills as well as any nursing interventions and or nursing skills that they have learned throughout either program. We also offer them the opportunity to use phlebotomy skills, so we have an IV arm available for them as well as multiple phlebotomy implements. We have a crash cart in the room for any critical care situations. We also have IV equipment as well as telemetry in order to monitor our patient. We provide documentation in real-time nursing world with our simulation sim chart equipment that is synced directly with our scenarios. It also provides them the opportunity to use equipment that they would use in a real life situation when they gather themselves into a nursing career. We also provide a medication pass, so we have a scanning implement so they can scan those medications into the systems.
Along with the simulation labs, Fortis College also has our labs for the lab work in each of the classes, and Stacy will explain our lab.
All right, so again, welcome to our nursing skills lab. I guess we can start off over here in what would be our simulated nursing ward. So we provide privacies in our bays for all of our patients. In here we have low fidelity mannequins and also just nursing skills mannequins. These are used for our nursing students to practice their physical assessment on, to also practice priorities of daily living. So they provide hygiene, they learn how to turn patients properly without injuring the patient or themselves. They also learn how to operate multiple various ranges of equipment. So we have our headboards, which they can take blood pressures, we can do eye exams, we have otoscopes, we can look into ears. We have pulse oximetry, so they can learn how to apply those. Each station has the identical headboards, but within each bay we're able to change the various ailments that might apply to that direct mannequin. So it provides them a variety of simulation methods. All right. We also have suctioning kits, so we're able to perform trach care as well as other oral suctioning on our mannequins. All of our cabinets are stocked with the various supplies that are designated based on bodily function or need. For instance, this cabinet contains trach cares and central line dressings where the students can practice those on our mannequins within this lab and our other lab. We also are fully stocked right now with PPE, so they can practice the correct sequence in donning and doffing that based on contact precautions for our patients. And we also run them through proper usage of chest tubes as well as any wound care that might be needed. All right, now we're in the sister lab to the lab we just left. Within this lab, virtually all the cabinetry is identical. Again, these are all based on system and need, all the supplies that are available. The difference in this lab virtually is we have the availability of having a pediatric bed in this lab, where we're able to use that for pediatric simulation of care of a pediatric patient. We have a Hoyer lift available for our nursing students to be able to learn how to maneuver patients using the lift safely. And we also provide an EKG machine so we can learn how to implement ECGs at bedside.